This is little. He had this eye tumor removed 2 times before me, and it grew back immediately with a vengeance. What did I do differently? I took it off and I treated the root cause of the problem. And so there's the tumor removed, and you can see how much skin it stretched out to accommodate the amount of tumor that was under the eyelid, let alone the part that was coming out. And that was him 5 months later, fully healed, and the tumor didn't grow back, and he was visual in that eye.
Hi, it's Richard Fluke here, guiding healing energetically, and this is part 3 of 3 with me talking to Dr. Marlene Siegel, who's a veterinary surgeon from Florida. Now, what I want to share with you today is that she goes into some really challenging clients, which you just saw at the very start, and I think you're going to love today's episode. If you want to find out more about what Marlene is doing and courses she runs for veterinary surgeons, but also for pet parents, then there are links below. There's also links below about the work that I do as well. Anyway, enjoy this episode. I think you're going to love it.
So Bentley, 5 years old, was diagnosed with squamous cell carcinoma on his nose. The owners went to a veterinary oncologist to get a second opinion, and the oncologist said the only option you have is to remove his nose, and he's still going to die. So the owners did not want to do that. And this is they obviously came to me, and this is the progression of his treatment. So you can see these lesions were very aggressive. Every week, we treated him every week, and we would do the lesions, and we would do our therapies. On the left is about as worse. That was the worst part that we had come to. And we continued our therapies, very dedicated pet parents. All of our treatments had to be done under anesthesia because it was right on his face and it was painful. So now you can see the progression here. This is Bentley. He's on the frequency machine. This best dog ever in my 40 years of practice. I don't want to say I have a favorite, but I have a favorite. And this is Bentley. And here he is. He just knew everywhere he needed to go, and he would just get right in. So here he is jumping into the hyperbaric on his own. Like, he just loved going through. He comes in the office wagging his tail, happy to come in. And then he's always happy to go home and meet his mom and dad and get his treatments in bed. So here he is as we start to see healing. We're about 6 months into our therapies, and you can start seeing the healing. And we just continue into November, into December. And the picture on the right was September 28th, was just last month. Now, he still has a couple little issues that we're dealing with, but look at the remarkable healing on his nose. And I did not have to cut his nose off. How amazing is that? And he's thriving. This is Ratchet, 8 years old, was diagnosed at that referral center with splenic lymphoma. That means cancer in the spleen. And this is his ultrasound, which just have to trust me. The area between the 2 white lines is really big and thick, and there's a lot of holes in there. That's all abnormal. So the owners did not want to do chemotherapy. They came to me. This is his blood on presentation. It was not even rouleau. It was sludge. It was just this thick glob in his bloodstream. This is on the right, 1 hour after his first session in the Magnosphere. And you can see that he still has rouleau, but the cells are starting to break up. This is at the 3-week mark of therapy. And this is when we saw a clinical change as well. So now his cells are separated. They're just starting to get some movement to them, but we started to make progress. At the 10-week mark, owners wanted to see how we were doing. So we did another ultrasound, and he's cancer-free. This was read by a board-certified radiologist, who we also had him read the original. And he goes, oh, absolutely, that was lymphoma. And I don't know what you did, but it's not there anymore. So that was pretty amazing. Now, it could have been gone earlier. We just didn't do the testing until then. And here he is at the 10-week mark, cancer-free, and lived a wonderful long life. This is Moon. She was 9 years. She was 9 years old when she came to me. We diagnosed her with a transitional cell carcinoma, which is a bladder cancer. We were able to treat that and resolve it in 5 weeks. But the reason I have her back in this presentation was because about a year later, she developed something called idiopathic vestibular syndrome. And it's called idiopathic because we really don't know what causes it, but they get very dizzy. They get eyes twitching back and forth, and they get a head tilt. So the vestibular part usually resolves, which it did in her, but she was left with a head tilt. Well, we had just started doing fascia decompression, and we decided to try using fascia decompression to see how much we could fix this issue. And I'm not going to show you all the pieces in between, but this is her a couple of weeks after the owners were doing the fascia decompression at home. You can see the head tilt is gone. And one of the other side effects that she had was being very weak in the rear end. And she was weak in the rear end from the time I met her. Even when she had the bladder cancer, her whole entire rear end was very weak. And I think that was because she had issues in the fascia, which probably led to her getting the bladder cancer. Look at this dog bouncing, like strong, everything resolved. And that was just in a few weeks, just doing the fascia decompression. One more fascia case for you. This is Copper, 13 years old. He developed this tumor on his left hind leg. Now, he had a tumor previously on the other leg, and the owners had it removed by their veterinarian, but he did very poorly through surgery. His recovery was very traumatic, and the owners were extremely reluctant to go through surgery again. So we were doing a lot of detoxification work and trying to avoid the surgery, but this thing was growing, and it got to the point where his quality of life was being compromised because he couldn't walk well. So the owner finally said, okay, we got to make a decision, because you literally have to start carrying him. And we decided to take the tumor off and risk the surgery. Well, this was a 4.64 pounds tumor that came off. On the right-hand side is his left hind leg, where you can see the surgery line, and the surgery went flawless. We had done so much detoxification work in preparation for this dog that his recovery was amazing. But I want you to see, this is the next day after surgery. Do you see how his left rib cage is just bulging out? This was all because of that tumor making him move differently. It's sort of like if somebody had an injured foot and they were compensating by walking and limping for a long time, your fascia starts to grip and change the way it's holding you in position because it's trying to keep you stable. So we were doing the fascia decompression, which is a group of maneuvers that you do with your hands to help melt the adhesions. And then on the left was where we started. On the right was his chest. And it's still a little bit of bulging, but way better than it was. That was 24 hours of the owner doing the fascia that we taught her. And then this is him actually able to move. And I did it in slow-mo so you can appreciate. He wasn't able to walk before surgery on his back legs at all. The day after surgery, he was still dragging his left hind leg, which is where we took the tumor off. And now you can actually see him using his left hind leg. He's placing it and doing amazing. This is Little. He had this eye tumor removed 2 times before me.
And I refer to this in the book, by the way. So this is really
okay. Yeah. So now when you read the book, you'll have a visual of Little and his eye tumor. And so it had been removed 2 times before me, and it grew back immediately with a vengeance. What did I do differently? I took it off and I treated the root cause of the problem. And so there's the tumor removed, and you can see how much skin it stretched out to accommodate the amount of tumor that was under the eyelid, let alone the part that was coming out. And that was him 5 months later, fully healed, and the tumor didn't grow back, and he was visual in that eye. How amazing is that?
That's incredible. I think that you told the story to me that the owner said, could you say the eye as well? And you went,
yeah,
I'll have a go.
They come in with his eye coming out and they go, can you make him visual? I didn't even know what was underneath that tumor, but that was really cool. All right, my last 2 cases. This is Prowler, came to me with advanced liver disease. Their veterinarian had said that there was nothing more they could do, and she was just needed to be euthanized. Another VIP pet, they owned a gym, and this dog was in the gym with them every day, working out with the people in the gym. Adorable, adorable. We treated her. Owner had a limited budget, and she lived over a year to celebrate her 12th birthday. This is us having a birthday party for her in the office. She came in for her therapy that day. And she didn't live forever, but she had 100% quality of life for another year when the owners were told they would have less than 2 weeks. Last case, this is Little Bit came to me having seizures, like literally in a seizure. It was on an emergency. We were able to finally break the seizure and stop it. And here she is after we got the seizure to stop it. She still had the nystagmus, the eye twitching, the head tilt. So I had to go talk to the owners and say, what do you want to do? I think this dog, she's 15. She has a lot of problems going on. Do you want to keep going? Or now that we're out of the crisis, is it time to say goodbye? And this is the story they shared with me. They said that they had another dog a couple years earlier that had become sick, and they took it to the vet, and the vet just said to euthanize, and they just did it. They never worked her up. They never tried. And they said all these years later, they still held that guilt and shame and just horrible emotions because they didn't try. And so she looked at me and she said, we have to try. This is the dog going home the next day. Now, she had a brain tumor. We got our workup, of course, as the days progressed. She had Cushing's disease. She had severe pancreatitis. She had massive nutrient deficiencies. And she lived a few more weeks and then had another seizure, and then the owners euthanized. But, my point is that they were able to not have those same emotions about guilt for not having tried. They did everything. They got a diagnosis, and they were able to make a more humane decision at that point. And this is why we do what we do, because our animals literally teach us what unconditional love is. We forget, but they don't. So I hope that was inspirational for everybody. And I'm going to stop there.
Well, Marlene, you brought tears to my eyes a couple of times.
Yeah, it's
you
pretty
always do whenever you share that stuff. Unbelievable. And hopefully people understand this. Your work is incredible. I've said to you many a time, you have to make more Dr. Marlene Siegels, and I know you're on that. If any veterinary surgeons are watching this, please just make contact with Marlene. And you do work with animals around the world. Whenever I've been to the hospital, I've seen people there have flown their cat from California to have treatment. I mean, at what cost? Sometimes we know that with animals, but then there's also this human piece, which just makes me so frustrated that even with myself, I go, well, I don't take any drugs, antibiotics. No, don't have them. There's times and places where these things are right, which you mentioned, and it's great to get a medical diagnosis. But still, we have so much that we can do that we're not. The wonderful medical doctors and even the vets who precursor to all of this stuff going on, they don't know either. We know why that is, but we don't need to go into it.
Let's touch into the emotional side of this, because it was my number 6 step, which I didn't really mention any of this, but I think it is the most important, if not equally as important to everything else that we do, is the emotional component. Because I have found over the years I've been doing this, that there is never an accident or never a coincidence that there is a particular pet in the lives of a particular pet parent at a particular time in their lives with a particular condition or challenge that pet is going through that has an absolute direct relationship to that pet parent.
I agree with you. It's the emotional link. We've done work, haven't we, together with clients, and I've worked with the person and we've cleared that up, and then the animal's cleared up. So there is this direct correlational link. Correlation, we could even say causation, but we can't really prove that. I believe there is causation at many, many levels. And also in the book, I think I do a very good job of just saying this is what's going on at the structured water level, at the mitochondrial level, at the melanin level, And so scientifically we can prove that. Energetically, spiritually, we could probably, we can't really prove that, but we can actually say that there is something going on. And your work, you will work with the pets, and then maybe the emotions won't be the most primary thing. For me, it's the primary thing, but then that's what I do.
No, it is primary for me too.
Yeah.
It is really, really important. And I know that every dis-ease has trapped emotions associated with it. Sometimes we just have to work a little harder to figure out what that is, but it is a primary part of my healing work.
From a mitochondrial point of view, we can pretty well enough say that anything, and the figures seem to point this way, that anything from 40 to 80% of mitochondrial dysfunction, which is the powerhouse of the cells, which actually, if they're not functioning correctly, then the body can't heal, is compromised by trauma. And we can support the body with all these other things that allow the mitochondria to go back to working, allow the structured water to restructure, which you showed so beautifully with the blood work. And it's just, I'm sorry, I'm a bit lost for words, actually.
Well,
I mean,
my intention was to show people that there are more tools in the toolkit. And it's certainly not about us staying on this planet forever. No one's leaving this planet alive. So it's not about that, but it is about moving from surviving to thriving. And then I think the other really important part is, what are we learning from the experience? How are we expanding our consciousness? How are we becoming more awakened? How are we starting to take personal responsibility for the traumas, and especially the traumas, because when we can link the emotion to the dis-ease, then we can start, which is your fascinating work, going back and finding, where did that get stuck? And then how can we heal that? And that is so powerful. I love reading your book because you have tied so well into your character, Marcy. We all are Marcy. We all have Marcys as part of our journey, some bigger Marcys than others. And as we become aware of those trapped emotions, as we become aware of the fact that this is a pattern, it's literally a fractal pattern that we're experiencing. And when we can start to recognize, oh my goodness, I am seeing this emotion. For me, I think some of the emotions in my life were betrayal and judgment.
The way that we can do that, and I talk about it in the book, is by, we've got to find it really first and realize that there is usually this big theme, and we need to find that. And that seems to be the big major theme. And how does that relate to animals is also very interesting, because the animal shows us where something's out of kilter. And we've done this, as I said, several times, where we've cleared the client, that is the human being, the person, and the animals got better. Or as you said, the animal is coming very, very ill, and we then work with the client, and then the animal passes. It's almost as if the animal had a job to do to point.
100%.
Yeah.
I agree.
And so
I've heard it so many times, and they pass peacefully. So
yeah.
And then you watch the transformation in the pet parent, and you realize that, like, we had a lady, it was very interesting. She came in, the dog had lymphoma, all the lymph nodes were enlarged, and had been doing very poorly. So we went the first 2 weeks, and all the lymph nodes are shrinking. The dog is doing phenomenal. Her emotional baggage was guilt and shame. And I recognized it immediately because it was coming out through fear, but that fear was really the guilt and shame that she was having about the dog having cancer. But it wasn't just the dog. It was past family members. It was all these experiences in her conscious memory. And so I had to clear her because she was really holding the dog up. So I helped her to realize that it was the shame and the guilt that she was reliving multiple times, and she acknowledged it. And so the dog starts to heal. We're doing great. And then she told me on Friday, oh, we're going to come back for another 2 weeks. We're going to keep going, because they were from another state. And Monday morning, they're on the doorstep, and they're packing their stuff up and they're leaving. And we were like, what happened? And so she goes, well, the dog isn't eating. Well, why isn't the dog eating? Well, it turns out she was putting all the medicine into the food. And so the dog didn't like the taste. And so the dog didn't eat for the weekend. Well, once we discovered what the problem was, it should have been an easy fix. But she wanted to blame me for not telling her not to put the medicine in the dog food. Well, we had a video for her that we recorded telling her not to do it. We had paperwork that she signed explaining how to feed the dog and give the medicine, and she signed it. But because her immediate reaction was to go back to that blaming and shaming, she wanted to blame me, and she just couldn't let it go. Even though we could prove to her, we had told her. And I said, it's not a big deal. Like, you don't have to make this a big problem. You forgot. We gave you a lot of information. I know it's overwhelming. It's okay. We're just going to back up a little bit and go a different direction. And she was so engulfed at that point in her blaming and shaming that she couldn't let it go. So it's just an example of how we get caught up in our story. And until we're willing to let go of that story, which you show in beautiful examples throughout the book, how we first have to come to an awareness, like we have to actually recognize you're playing out a story. And this is a story you've played out many, many, many times. And I equate it to a computer program. When your computer has just so much of a hard drive in it, there's not any empty space. And so when it gets full, you have to delete something. And so you pull up a file. You can't stand from the back of the room and shout at your computer, delete, right? It's not going to do anything. You have to literally open it up, turn it on. You have to pull up the file, and then you have to look at that file and say, do I need this file? Is it something that's going to be useful for me? If it is, keep it. If it's not, then you hit the delete button. And it's so funny when I ask people, what happens when you hit the delete button on your computer? And they all say, it says, are you sure? And that's what our brain does. That's your subconscious mind. Before you delete a program, it's saying, are you sure? Because I know this program. I don't know what's on the other side. It's an abyss because you haven't put anything else in there to replace it yet. But the work that you do, Richard, is amazing, because not only do you help them to identify what they need to get rid of, but then you replace it with something that's more serving, and the healing is so easy after that.
Yeah, our bodies play catch up with our thoughts, really, and that's what I've experienced over and over and over again. Oh, it's so challenging, isn't it? But also it's wonderful to talk about that. Well, we should really complete there, shouldn't we? Because I could spend all day hanging out with you. You know that I have over in the hospital, and Alicia's daughter as well. So
thank you. I think the major points that we covered, and I feel really good about it, is one, we showed people what's possible.
Yeah.
We gave them a blueprint of something easy enough to follow. And then we help them to tie in the emotional component and the fact that nothing is an accident, nothing is a coincidence. And it's when we pause to breathe and feel into the situation and actually ask those questions. What am I experiencing? Why am I experiencing it? Can I name it? Can I decide, is it something that I've been doing over and over again? Is it now not beneficial to me? And do I want to change it? And then find a practitioner like yourself, or using the book to help guide you into making those transformations, because we really do have a magnificent world. This is such a magnificent opportunity, even with all the chaos and darkness that we see around us. I couldn't pick a better time in the world to be here, because we are making such a big impact in the world, right? Like, how boring would it be if there was just nothing to accomplish? Now we can really step up to the plate and go, wow, I get to make a huge impact in the lives of, for me, pets and their parents, and you and people and their pets, and just really be able to touch the world in a way that we probably couldn't have done it 30, 40 years ago. As I said to you earlier, I'm just in awe of your work. It's just absolutely incredible. And the very first time I came to the hospital, it was just, this is
unbelievable, and was a lot of inspiration behind the book as well, just seeing these things happen with animals, but we know they can happen with humans. We just don't hear about it, and there are doctors out there that I talk about in the book as well. Anyway, thank you so much, Marlene. Thank you.
Much love, everybody. Thank you, Richard.
Thank you.
I really hope you enjoyed watching this incredible work of Dr. Marlene Siegel. And I also hope that you take the time out to listen to some of the other How Can I Heal podcasts. If you want to find out any more information about my work, about Dr. Marlene's work, all the links are below. And until we meet again, have a great rest of your day.